Welcome everyone to today's Global Café. My name is Emma Schmidt and I'm a project and policy coordinator with the IFA. I'm very excited to be moderating today's discussion on gendered ageism, the double whammy of discrimination, and how to address it. With global population aging and the feminization of aging, there's a critical need to understand and combat the impacts of gendered ageism. The intersection of ageism with sexism disadvantages a growing proportion of the population from accessing services, maintaining their functional ability, and achieving whatever it is they would like to achieve. I'm very pleased to have Ms. Peggy Edwards and Dr. Paula Rochon joining us today to discuss these intersectionalities and to contextualize these challenges. Ms. Peggy Edwards is an advocate for the rights of older persons and an author on aging who specializes in issues related to gender, health promotion, social justice, grandparenting, and intergenerational equity. She authored the World Health Organization publication titled Women, Aging, and Health, a Framework for Action, focused on gender, and is a founding member of the Grandmothers Advocacy Network, who advocate for the human rights of older women, young people, and gender diverse persons. Peggy is in her 76th year, lives in Ottawa, Ontario, Canada, with her dog Molly. She has impressive lived experience with intergenerational collaboration and has 11 grandchildren and 10 great-grandchildren. Dr. Paula Rochon is the founding director of Women's Age Lab, which is the first and only center of its kind in the world that focuses on improving the lives of older women. She is also a professor in the Department of Medicine at the University of Toronto and is the inaugural Rotero Chair in Geriatric Medicine at the University of Toronto. Dr. Rochon chairs the Institute of Aging Advisory Board for the Canadian Institutes of Health Research to support research and promote healthy aging across Canada, and is also the deputy editor of the Journal of American Geriatric Society. She's a fellow of the Canadian Academy of Health Sciences and a fellow of the Canadian Geriatric Society. So thank you, Ms. Edwards and Dr. Rochon, for joining us today. I'm really looking forward to our conversation. To kick off our discussion, I first just want to ask you both what your definition of gendered ageism is, and if you could provide some examples of what gendered ageism can look like. Maybe we'll start with you, Ms. Edwards.
Yes, good morning. Good day, everyone. Thank you for inviting me to this wonderful event. I would like to acknowledge that I'm living in Ottawa, Ontario, Canada, which is unceded territory of the Algonquin and Anishinaabe people. And I would particularly like to acknowledge the past and present contribution that our elders in that community have given towards the land and also to the topic we are discussing today. Okay, how do I how do I understand gendered ageism? The simple answer is that we know ageism is defined as the stereotyping, prejudice, and discrimination against people based on age. So the term gendered ageism is used to define the intersection of gender and age in that scenario. I have a lot more points about gendered ageism, but I think it's just important that we all start off in the same footing to say that in a world where patriarchal norms still exist, older women are most often subject to experiences and greater consequences of gendered ageism. However, gendered ageism is not only exclusive to older women. People who express diverse gender identities may experience the same kind of mistreatment and discrimination in older age. And older men may also be subject to gendered ageism. The other key points is that this intersection between age and gender also intersects with other determinants of health and identities, including Indigenous identity, immigrant status, socioeconomic status, and ability disability. And lastly, to say that gendered ageism, gendered stereotypes, inequalities do not vanish with age, but they're rather compounded. So we need to take a life course approach when we talk about gendered ageism. and particularly to be concerned about the human rights of young people in addition to older people. Okay.
Thank you. Thank you for that. Dr. Rochon, would you like to give your definition of gendered ageism?
So it's a pleasure to be here today. It's interesting when you think about ageism, and we're talking also about gendered ageism today. I think it's something that's become more important to us. Maybe even in the recent years. I mean, it's something I've always known about, but something that has really stood out for me as being incredibly important in the last couple of years. So, as Peggy was saying, ageism is basically discrimination based on your age. And when you add, and it's also compounded by sexism, which is discrimination based on your sex. And the thing about women is that they potentially face discrimination based both on their age and their sex. So they have kind of this sort of double impact as a result of ageism. And it's something that I think is kind of pervasive, and it's something that people don't even recognize in their daily lives. But when you stop to think about it, it's probably there in so many places. And really, this is part of the motivation for us starting, Women's Age Lab. When we started this group, which is a research center focusing on older women, trying to elevate their issues, there's so many things that we could have focused on. We picked 4 areas. One was thinking about how do you reimagine aging in place? How do you optimize therapies, and how do you promote social connections to reduce loneliness? And when you think about it, gendered ageism is kind of an issue that runs through each of these things. For example, optimizing therapies. Women we know are more likely to have adverse drug events. Well, we also know that it wasn't until the 90s that in US federally funded studies, women needed to be included in clinical trials. And it wasn't until just even more recently that older adults needed to be included in those trials. So as a result of that, you can potentially see the impact of this happening on women potentially being more at risk for adverse drug events because they haven't perhaps been studied as well in the clinical trials. So everything you think about, when you think about it a little bit more, can be impacted by things like ageism. And it's just something that we're not always thinking about. So it's something we have to just put that lens on everything that we're doing.
Wonderful. Thank you for sharing that. It's interesting that you mentioned that gendered ageism can be so integrated into so many areas of life, including those 4 kind of priority areas of the Women's Age Lab. Do you mind expanding a little bit more on how or why gendered ageism is so integrated into these aspects of life, and perhaps share a little bit more about how gendered ageism contributes to worsened health outcomes or difficulties for older women or older gender diverse people?
Well, I think one of the things about gendered ageism, some people say it's like a social determinant of health, that it's sort of one of these non-medical things that really does impact your health. And that's an important way I think you might want to frame it. So, for example, it hits so many different things. If you think of, for example, people like my mom. So in her day, when she was, starting out in her career, people, women in particular, would not have been so encouraged to, for example, pursue education. And it may have been more expected at that time that you are married and you have a family. But women who do enter careers, likely may have entered careers where they may have been paid less than men, for example. They probably took time off as part of their career to have children. They may have come back after taking time off, but they may not have. Women we know are more likely to have caregiving type responsibilities. So over the course of that career, they may have also had time where they were away, for example, to provide caregiving to other family members. And as a result of that, at the end of the day, when women, for example, retire, for those women who may be, for example, in positions where they may be entitled to getting pensions, we've seen worldwide that women end up with pensions that are less than their male counterparts. I think around the world, it's about 26% less. So things like that eventually play out to impact your health. For example, women end up not having the same kind of resources to pay for things that may be in additional to insured services, or just may not be available and can impact their health. So, for example, it could be things like, maybe people may need something like a hearing aid or glasses, something that, are very important, but may be expensive. So things like some of this kind of discrimination based on your age and based on your sex can have an impact that can impact people in ways that are not only unpleasant, but can eventually end up impacting your health. So maybe that's one kind of example. But if you think about things, I think you can see how it can impact so many different parts of our lives.
Mm-hmm. Really is a systems level challenge. Ms. Edwards, do you have anything you'd like to add about some of the root causes or historical challenges leading to gendered ageism?
Yes. When we think about examples of gendered ageism, there's a huge range. Examples certainly from so-called jokes and birthday cards. In fact, I've been doing a little informal project, sending around and asking people. I send jokes and cards, and I ask people, is this ageist? Is this sexist? Or is this just plain funny? And the results and the what I get from people is really interesting. And the majority of times they are sexist, they are ageist. So it can be as simple as that. We know it's really well documented, gendered ageism in the film industry and in media. But then it can lead to very, very severe consequences as well. Abuses such as laws and social practices that restrict older women's right to property and to lifelong learning. In the Grandmothers Advocacy Network, we look at protecting and advocating for the rights, the human rights of older people and younger people. And we look at it in 4 areas. Paula mentioned education and lifelong learning. Certainly we know, and I have to say again that gendered ageism plays out very differently in different countries and in different regions within those countries. But we certainly have examples of girls being denied access to education. And that means that they're older women who have no education. And what we're seeing and are the most illiterate in the world. But what we're seeing is that older women in particular, and older people of diverse genders are asking now for lifelong learning and to make up for that lack of education. The second area that we look at, Paula spoke about, is economic security. And that is a result, or lack of economic security, is the result of access to work, to decent work, paid employment, as Paula spoke about. But it's also lack of pensions in many countries. And women are much less likely than men to have pensions because, as Paula pointed out, they came in, they worked in lower paying jobs, they leave their jobs for caregiving and do not have the pensions. The third key area is participation, and gendered ageism limits their participation at the local level in politics, in every area of life that's important to quality of life as we get older. The other area that's really critical that gendered ageism contributes to is violence. And one of our key areas that we advocate for is the right to nonviolence and to a safe older age. We know in some countries there are some torturous widowhood practices. We know about the jailing of older people who identify with the LGBTQ2+ community. We know that all over the world, older women are 10 times more likely than older men to experience abuse in their later years. And this, particularly domestic abuse, which of older women, which is perpetuated by family members, is often overlooked and undocumented in all countries. Once again, with a life course approach, in the younger years, girls and women are the victims of physical and sexual abuse in 90% of cases. This has a significant impact in later years. So these are just some of the examples of the way that gendered ageism can affect the quality of life and the rights of older people.
Thank you, Ms. Edwards, for that answer. I appreciate you bringing a global perspective into the conversation today. And it's unfortunate that gendered ageism is something that is, uniting so many people in the global population. I see we have a question in the chat from Shmuel, and he's asking, how can we tackle gendered ageism specifically in low and middle income or socioeconomic groups in the population? Would either of you like to kind of share that perspective?
Well, what you're raising, of course, here is the triple whammy. What we talked about of the interconnections of both gender and age. Then if you add income and other factors, you've got a triple whammy. I think towards the end, we're going to talk more about solutions or how to handle it particularly within these vulnerable groups. But off the top of my head, I think there's two areas that are really important for this vulnerable population group. And that is policy. We can have good policies at all levels, local, national, international, that bring this situation to the fore, that help identify this problem with this vulnerable population and advocate for change. I think that health professionals have a big responsibility here in terms of how they handle and treat older people living in low-income situations. And I think it's really important when we talk about advocacy for this group to include them, so that when we're advocating for equality, sexual equality, that we listen to and take into account older people who are in vulnerable groups like low income.
I mean, those are, really important questions. How do you start to think about addressing some of these things? But it also goes back to just thinking about what's happening in our everyday lives. Peggy, you started talking about examples of how it may impact people individually. You mentioned the example of birthday cards, something like that seems so benign, but it's some of those sort of just connections that are happening on a daily basis that people somehow are accepting and not questioning. People suggesting that there might be seniors moments, or suggesting that with age, you're going to be more forgetful, things like that. Maybe they seem harmless, but when people internalize that, they start to feel that maybe they're not able to contribute as much, or maybe they should back off, or maybe they shouldn't take on new challenges. And that kind of thing can lead to people becoming isolated or not contributing to their full kind of potential. So when you think about things like that, in terms of starting to think about solutions, it's recognizing, I think, in part, that these things are happening and taking a stand to say that, maybe this isn't okay. This isn't something that we want to accept, and really pushing back on some of those norms. And as you say, we see it in so much. You mentioned media. You see it in images, how older people are shown in various kinds of, whatever it is you're looking at. People are often portrayed as being very frail, where, yes, some people are frail, but the vast majority of older people are actually, living well and are living independently and, making important contributions. We need to make sure we're reflecting the reality of what the situation is related to aging.
Mhm.
Yeah, if I could just reinforce that and the importance of identifying this issue. The most common thing I have heard over the years from older women is that they feel invisible. Invisibility is a huge factor, and we need to make it visible. And we need to talk about this concept of gendered ageism and how it affects, how it plays out in the community and with individuals.
Mhm. So entrenched into so much of what we do in our vocabulary, in how we're interacting, even Miss Edwards, as you mentioned, in our humor and our jokes and our media. So that kind of segues nicely into the next question that I had, which was, how do we start these conversations, continue these conversations, and make this issue more visible?
So, I mean, one of the things that I think people, there's so many different things that people can do, and it's nice to have a bit of a framework in terms of how you can kind of approach this. And I really like some of the work that's being done internationally through the WHO, helping people, raising awareness about the issue. So we're having conversations like the conversation we're having today. So how do you address it? So one of the things is having contact between people who are older and people who are younger. There's so many opportunities to potentially get together and share information. People who are older often have more experience. They may have different kinds of experience that could be very valuable to mentoring younger people or helping them. And having people come together makes people aware of what, aging is really like, what it's like to be young, what it's like to be older, sort of to take away some of those divides. So I think opportunities where you can take advantages of what older people can offer and younger people can offer and promote those intergenerational connections is really, really important. I think we've been far too silent on this issue. As Peggy mentioned earlier on, it's one of these isms that is still sort of allowed to happen. And people haven't really come out and said strongly that this isn't okay. And, that's why we're having conversations like the ones we're having today. But having opportunities to have educational opportunities and discussion to talk about, why this is important and how it does make people feel bad, but also potentially impact their health in ways that we might not necessarily consider. And then to think about what are some of the things that we can do from a policy perspective to make a difference. So, for example, some things are age related. For some medical treatments, it may be related to your age. Is that really the way we want to move forward? Employment and who's going to be eligible can be related to age. Is that always a good thing if people want to continue to work in various different ways? I mean, there's so many ways that thinking differently from a policy perspective can really also help to change the outcomes. So there's a lot of different things that I think we can do to sort of start these conversations and to start to make a difference.
Yes, and I would add to that. I see there's a question in the chat box about making sure this issue is on the agenda at the highest levels, and particularly at the UN. And I know there's someone on the line, Margaret Gillis, who has a lot of experience with this, and I hope that Margaret, you'll be able to speak to this later. However, I can't stress enough how important it is that the human rights of older people are at the attention at the UN level. And you do have a resource list, a short list of resources that we recommended. And one of them is a recent document from the UN about gendered ageism, and also from the organizations, the civil society organizations who are working at the UN level to make people more aware of ageism and gendered ageism. The second really key thing is building on what Paula has said, that I feel very strongly about, is intergenerational solidarity. The research is clear that one of the best ways to deal with and prevent ageism is with intergenerational activities, that could be interpersonal, people with their own families, it can be programs, it can be policies. In my experience, and with the Grandmothers Advocacy Network and with myself as a grandmother, as you heard earlier, when we march together with young people about climate change or access to medicines, when we visit Museum of Civilization and learn how our elders have been leaders, when we talk with and demonstrate with younger generations, they understand what gendered ageism is. And there's far less likely that they will grow up perpetuating this because they haven't been informed. So intergenerational solidarity, I think, is really key. And it's solidarity. It's not saying to young people, you know, you should do this, you should do that. It's working in solidarity. And one of the things with the Grandmothers Advocacy Network, our most recent campaign is on food security. And what we have found in our research and in talking with older people in the global south, particularly in sub-Saharan Africa, where the grandmothers are raising millions of young people orphaned by HIV and AIDS. When we've talked with them about intergenerational solidarity and the issue of food security and agriculture, what we're hearing is that older women are very disadvantaged and discriminated against in this area, even though they do the majority of agricultural work in the world. But at the same time, it's young people who are fortunate enough to have an education or getting an education. It's young people, particularly young women, who are working side by side with the older women to deal with agriculture. And, you know, if we talk about some of the areas in Africa that have been particularly hard hit by climate change, it is the young women who are working with the older women who are the keepers of the knowledge and the keepers of the seeds, the traditional seeds, and other ways of growing and making food to feed people. So that's, I think, a really good example of where intergenerational solidarity plays out.
Thank you for that. It's a very empowering message to hear the importance of intergenerational collaboration and how that can impact policy and practice, like you're talking about in terms of knowledge sharing. I'd like to invite Jane to share her question if she'd like to unmute.
Thanks, Emma, and thanks for a stimulating conversation, both to Peggy and Paula. You've touched on it, Peggy, but I want to return to it because you and I were involved in this area 20 years ago. And while there's been incremental progress, it's incremental. And I still maintain, unless the UN and WHO vigorously and purposefully and deliberately put older women in their discussions, their deliberations, and their policy briefs, member states will not do anything. And I have to say, even as a proud Canadian, there is tacit indication of older women in policies and poor and absent investment. So, I'm not prepared to be passive any longer. So what would your advice be? I mean, look, I get the bottom-up approach, etc., but that is only as good as the political ears. And if the political ears are not there, not going to happen. So what could be really, some actions that, civil society could take? Because I know, IFA's main rep at the UN is on the line, Cynthia Stewart. We've got Mar Gillis. We've got many people that feel the same way. But we can't even get a statement on older women in the UN Women to begin with. So, it's we have to I feel like I need to fight harder and louder somehow. So I'd really be interested in both of your views.
Dr. Rochon, would you like to go ahead with that question?
Well, Jane, I mean, I think you've raised such an important issue, right? And I think it goes back to the idea that older women are viewed as, basically being invisible. They're just missed out on so many conversations. When you talk about older people, it's as if everyone is the same, right? People who are, maybe 60 as opposed to somebody who's 90, who have maybe perhaps very different issues. Women and men, everyone is grouped together. And that means that you miss out. When you look at discussions about women, often it relates to issues that may be important to younger women. Those are important issues, but they may not always be the same issues as it relates to an older women. And so this is missed. One of the things that, coming at it from a research perspective that is quite sort of noticeable is that when people present data or look at data, as I say, they'll often present information about older adults in reports you look at, all sorts of different documents as, over a certain age, whether it's 50, 60, 65, whatever the age group is. And they don't disaggregate it by age and they don't disaggregate it by sex. A simple thing that we think could be really helpful is to encourage people who are doing research, who are doing policy work, whatever it is you're doing, when you have information, when you collect data, look at the differences between women and men and by age groups. And you start to see important patterns coming forward that show why you need to think about things differently. So for example, if you think about things like chronic conditions, they often increase with age. You may see important patterns as people get into the older age groups. If you don't look at those older age groups, you don't see those kinds of differences and don't necessarily see why it's important to think about these groups separately and why they have different things that need to be addressed. So it seems like a maybe a simple thing to do, and often we have the information, but having that information, will help, could, I think, play a major role in helping people think about why you need to think about women and older women separately, from a policy perspective.
It's just one comment that I think it feels like an elephant in the room. Post-reproductive age, women don't exist. And if you go and look in the WHO technical units, we've got child and maternal health. And so I think we've really got to sort of really be laser focused. This is ageist to begin with, and I don't disagree with you. You're absolutely right. But I think we need to start naming it, because that's exactly what's happening. So I will be quiet for the rest of the cafe.
Well, I think what you're saying is so important in terms of naming it. And that's why we started Women's Age Lab, because I think it's very telling to think that, to our knowledge, there aren't other research centers in the world focusing on older women. How could that be? We're in a society where pretty well, 20% of our population are soon going to be over the age of 65. The majority of them are women. There's differences between women and men that become more apparent with age. And we're amongst the first that are really taking this on from a research perspective. That's just, how could that be? I mean.
Mm-hmm. And I would reinforce, Jane, and thank you for the comments, but naming it is absolutely critical. But Paula makes a really good point, is that elected officials, politicians, they look at the numbers, and we do not have the disaggregated data that we need in terms of both age and gender. And partly this is a technical issue, certainly in some low-income countries. Data is collected at the reproductive health clinics. So once you're past that age and you're not going to those health clinics, we have no data. We don't have the door-to-door data on gender and age in many countries. Even in Canada, which has one of the best data systems, collection of data, it's only in the last year that the LGBTQ plus identity has been identified as data that needs to be collected at all ages. So the data, I mean, I have a T-shirt that I got from the UN Women's Group that says "Older women count," and it's a double entendre. You know, older women count in terms of the wonderful contribution they make to their families and countries and communities, but they need to be counted so that we have this data. And we need to strongly oppose government policies that aggravate inequities in older age, particularly for those who are most vulnerable to double, triple whammy disadvantage.
Thank you for all of that insight. We talked a lot about some of the gaps in research, and in particular, the importance of data collection and disaggregated data. Dr. Rochon, I was wondering if you could expand a little bit more about how researchers can consider women's specific needs as they age and gender diverse individuals' needs as they age.
Well, I think when researchers are setting up, for example, their projects, I think from the very start, they need to think about how they're going to incorporate that information into their project. I mean, often you get some basic information about sex and age, but it's not really necessarily set up in a way that's going to lead to changes going forward. It's kind of often dismissed. So I think there's sort of strategies to get people to think about this. So from a practical perspective, you know, maybe it goes back to when people are looking at funding applications, you know, making it one of the requirements to think about when you're putting in funding applications. And I know Canada's done very well in this regard in terms of thinking about, they talk about a sex gender-based analysis kind of approach that is something they want to have considered in research proposals, and it needs to be thought about. The problem is that it's often mentioned, but it's not necessarily actioned. You know, I mean, it's come a long way in terms of people thinking about these things or being asked to think about these things, but we need to push forward to make sure it's continued throughout the project. And when you're conducting research and you've included older people in it, which is important, and you've included women in the research, it's also really important that you report out that information. Because I mean, it is so frustrating when you know the data are there and then you kind of see a overall statement in the end where you've potentially lost all of that valuable information. So there needs to be a requirement around the reporting piece as well, so that it's sort of followed through and people can take advantage of that information. So maybe some simple pieces like that can help raise the profile. But everyone has a role. You know, it can also go down to the people who are publishing these reports, making sure that that's a requirement on their end. You know, where are the older people? Where are the older women? How are we looking at the differences? So we can all, you know, play a role in trying to make sure that those pieces are elevated. And in the end, we have the information that we can start to act on.
Thank you. I think we're very privileged today to have both the advocacy and policy side as well as the research side of the conversation with both, you know, Ms. Edwards and Dr. Rochon. And Dr. Rochon, your comment on the fact that everybody has a role really sticks out to me. And I'd like to hear both of your opinions on the importance of collaboration between advocates and researchers, or turning that research and turning that data into action. Ms. Edwards, would you like to share your thoughts on that?
Thanks, Emma. You just summarized what was buzzing through my mind here as Paula talked eloquently and with great experience about research. I spent a lot of time in my career taking research and putting it into plain language that policymakers and others can understand, and feeding it to the media and now social media. We need to do the research in the right way, but then it's making it understandable and useful to civil society organizations, And I want to stress too the importance of civil society organizations. They're not typically thought of as researchers, but more and more. I see in the chat group that someone is here from Help Age. And Help Age has done some really good research looking at the lived experience of older people and how gender and ageism affects that. So it's those kinds of publications and getting the word out in an understandable way, I think is really important.
And it's also the opportunity. I mean, it's so important to have, the public thinking about these issues, because it's the sort of thing that maybe when people think about it and reflect on their own life and their circumstance, they see it, or they will see it in just so many different things that maybe otherwise kind of go unnoticed. And that's another way that you can sort of start to bring attention to it, the way people are seeing it in their own experience.
Thank you for that. I see in the chat here we have a question from Yagana Imam, and I thank you for your patience as we got to your question. This is going back to something that we mentioned earlier, which is the importance of a life course approach, and that, ageism starts early in terms of the attitudes that we're instilling in people about aging, as well as the experiences and opportunities available to people throughout their life. And their question is, in countries where there's high unemployment among the younger population, how can we ensure economic security of older people? Ms. Edwards, would you like to take that question?
Wow, that's a difficult one, and one that we're experiencing all over the world right now with an economic turndown. I guess that, to me, we need good policies that enable young people to get decent work. And that goes back to education too. In my day, you could afford to go to university because the tuition was highly subsidized. Nowadays, that's not the case. So many young people are missing out on advanced education, trying to get jobs and not finding decent work. So I would say that's a key factor in increasing the ability of young people to have decent work. And then in the workplace, again, intergenerational solidarity. So younger people working with older people, so that there is a continuation here. The other thing, of course, is the nature of work has changed. So many people are on contract or working for themselves. So the old days of you got a golden handshake and a good pension are gone. If I look at my 4 children, only one of them works for an organization that has a pension and benefits.
Those are really, really strong, important points. And again, speak to the importance of policy that addresses aging and, from a life course approach. Dr. Rochon, would you like to add anything?
Well, I think, Peggy, you're mentioning the piece about encouraging education as being something that's really important. And that's too where there's discrepancies between women and men. Women had traditionally been less likely to be able to pursue education or encouraged to pursue education. And that's something that we really is changing and something that we really need to continue to encourage. And when we're talking about ageism, we've talked a lot about the ageism related to older people, discrimination based on your age affecting older people. And that's, the focus of the conversation, a big area. But we also have to recognize that there is also discrimination against people who are younger as well. And that can affect employment too, going forward. Sometimes people are told, you're too young, you don't have enough experience, and not allowed necessarily to have opportunities that could be valuable. And I think we have to go away from that. It has to be based on what people can contribute. And older people can encourage younger people to sort of stand up and to, be clear about what they have to offer. Because, sometimes they do face discrimination too on the younger side as it relates to things like employment, which is important to address.
And I just see a brilliant comment in the chat box from Nancy Lisvet. She says, it's true that older women should be protagonists in research and activism against age discrimination, but that leadership should begin at an early age. We need to empower girls, young women, and adults in the face of their own aging.
What a powerful message that is. Earlier, you mentioned, Dr. Rochon, that the topic of gendered ageism has become maybe a little bit more visible, or people have become a little bit more aware of the intersectionalities that exist. And tying that into Nancy's comment about the importance of empowering girls from a young age and maybe some social changes towards empowerment from a young age, why do you think that gendered ageism has become more, been brought to the forefront in recent years? And how do you think these social changes will impact gendered ageism in the future in terms of these young girls who are maybe having more opportunities aging themselves?
Well, gendered ageism, as I say, is still relatively, or the concept is relatively new, right? It hasn't been out here for that long. It was in the 60s, I think we were starting to talk about ageism, and it wasn't until like almost a quarter of a century later that we were starting to add in the gender component to even think about it. So there was a lag time there. But I would say too that, some of the inequities, especially for older people, have come out even more recently during some of the COVID experience, where people no longer, it was, you couldn't do some of the things that you normally could have. And all of us, I think, had the experience of what it might feel like to be, somewhat isolated. Younger people and older people couldn't necessarily go to their places where they would gather socially, whether it was, community places or whether it was educational places, wherever it was. And people started to feel what it was like to be isolated. And, I think some of that maybe increased some of the awareness of what the impacts of things like ageism or discrimination based on your age and sex might be like. So I think everyone had a chance in a way to sort of experience it. And I think that made people perhaps a bit more aware of what it was like. So some of these recent experiences, I think, have brought that more to the fore. So people are starting to talk about it, in ways that perhaps it wasn't maybe as relevant to them in the past.
Ms. Edwards, would you like to expand on that answer?
No, I think Paula has said it brilliantly, and I'd like to hear from other people on the call about their ideas about this.
Yeah, I'm seeing lots of great discussions going on in the chat and requests for future speakers. So it's great to hear that gendered ageism is something that so many participants are interested in, and that there's a lot of people doing a lot of incredible work to address. I see we have a question from Catherine Klein. Catherine, if you're able, would you like to unmute and ask your question?
Sure. Sorry, I should put on my video too. I'm sorry, it's got both. Anyway, my question is that we're seeing a lot of backlash, particularly as women do start to gain more power. I was just reading, which is great, that women now outnumber men even in higher education in China. And I read a while ago that they did in Karachi University in Pakistan. But I'm also seeing a backlash, and I was just appalled myself reading the New York Times Magazine last week to see we're back to skinny women who could only exist if they're, meant to look like the robots that they appear to be, and in sexually provocative stances. So I wondered if you are seeing that backlash occur, that men who are facing what they see as being a world that women now start to become more noticed, that as that happens, we're starting to see that backlash? And if so, do you have any suggestions of what we should do to combat that? Thank you.
Thank you, Catherine. Dr. Rochon, would you like to address that question first?
Well, I think it's wonderful that, we're in an era now where women, for example, when you're thinking about university, and I think that's sort of one of the pieces that you're mentioning here, that women are going into higher education. And in some cases, there's more women in those opportunities than men. I mean, I think that's what we want. And, maybe there will be some, I don't know, maybe there is some backlash related to that, but I think it's what we want and it's what we need and it's what we need to encourage. We need to make sure that people have the opportunities to pursue whatever it is they want to do. And while, maybe there's some pieces around the stereotypes, I think now we're seeing women entering in areas where maybe they were certainly not traditional, and women are now having an impact. So I think it's a very positive thing to see this trend happening, and something that we want to find ways to encourage.
But I would certainly agree we're seeing a backlash for sure around the world. And Catherine mentioned China in particular. But I think it's happening all over the world. There is a backlash as women become empowered and are seeking office and are more involved in higher education. This backlash, from what I'm seeing, is coming as what we sometimes call right-wing policy. And I'm very frightened. For example, what's happening in the United States in terms of right-wing policy. I can see lots of people nodding their head in agreement. One of my nieces lives in the United States, and she just gave birth to a beautiful baby girl. And she said to me, I've just given birth to a second-class citizen. She's going to fight that. But the backlash in right-wing policy is a big issue. And that's political. That's advocacy. That's political. And that's electing people who understand how important gendered ageism is and what it can do to people in older age. Yeah, I guess so. I'm back to advocacy here. Mm-hmm. and electing people who understand this issue.
Mm-hmm. Of course, it's like we've mentioned throughout this session, it's a systems level issue, and therefore it requires systems level change, from research to advocacy to policy to the policymakers. But as we're kind of entering into our last few minutes of the session today, I just want to take a minute to say thank you to our speakers, Ms. Edwards and Dr. Rochon, and thank you to everyone in attendance today, and for everyone who's been adding to the conversation in the chat and with their questions. Before I ask our speakers for their key takeaway messages, I would like to invite everyone in attendance to attend next week's Global Café session as we speak with Mr. Ryan McFarland about the life course approach to immunization and how this can be used to combat health inequities, which will be another really great session on aging and health. So Ms. Edwards and Dr. Rochon, before we go today, I would just like to hear your key takeaway messages or a bit of a summary of today's session, what you'd like to leave people with. Dr. Rochon, we'll start with you.
Well, I think one of the take-home messages is that gendered ageism is something that's a bit of a thread that runs through, just about everything that you can think about. And from a research perspective, the areas that we're focusing on related to older women, you see how that thread kind of goes through everything that we are focusing on. And it's something that we obviously need to find ways to address. But one of the things, maybe a key message that I think everyone should think about is this is something that isn't just over there and impacts other people. It's something that impacts all of us. You know, we are in a society where it is an aging society. You know, we are now having, at least in Canada, we're at a situation where there's now more people in the older age group than there are in the younger age group. And a lot of these, the majority of these people are women. So there's an important demographic here. But the piece that I think people don't necessarily realize in terms of why these issues are important is that it's impacting all of us. I mean, we are all aging. And this isn't something that matters to people over there or people over there. It's something that matters to all of us. And so it's important for us to think about it and to be part of how we make the change that is needed going forward. You know, we're all aging.
Thank you, Dr. Rochon and Ms. Edwards.
Okay, lots of takeaway messages. This has just been so stimulating, and thank you to everybody for this conversation. I think that the biggest two takeaways for me is increasing the visibility of gendered ageism. As Paula said, you know, it really is a fairly new term. And I work with some people who work and teach in gerontology who don't know this term, you know, and don't know exactly what it is. But putting it on the agenda at the highest level, at the UN level, to the most local level. And the other key takeaway for me here was the range of solutions or range of ways that we can address this, prevent it and address it. And that ranges from policy to practice to programming to interpersonal connections and intergenerational solidarity. And I think we need to use all of those as effective ways to address gendered ageism.
Thank you for those takeaways. I just want to echo what you said, Ms. Edwards. It was a great session today, and I hope that everyone was able to learn something and just have a bit more of a think on the impacts of gendered ageism. Thank you again to our speakers and for everyone in attendance today. Enjoy your Friday.